A straight lumbar spine, non-surgical fix most doctors miss. So if your MRI or X-ray say your lumbar spine is straightened or if you lost your lumbar lordosis, this video is for you. It may also say flat back syndrome. The straightening of the lumbar spine, it's not just bad alignment. It could lead to a disc bulge, disc herniation, pressure on the nerves, chronic back and leg pain, and sometimes even surgery if you leave it uncorrected. But here's what most people, even many doctors, don't realize. This can be corrected without surgery. In my last couple videos, I showed you the exercises and spinal adjustments that help correct a straightened lumbar spine or flat back syndrome. Now, in this final part of the series, I'm going to show you the missing piece, lumbar extension traction, or what we call three-point bending. These three procedures together form part of a research-based corrective care system known as chiropractic biophysics. This is designed to restore your natural lumbar curve, take pressure off the disc, reduce or eliminate back and leg pain, and avoid spinal surgery and long-term spinal degeneration. And if you stick around to the end, I'm going to show you how to find out if this approach is right for you and how to find a chiropractic biophysic doctor near you. Hello, I'm Dr. Gregory Kramer. I have a practice in Livonia, Michigan. I have over 35 years in experience in treating chronic health problems. I'm certified in the #1 corrective care technique in the world, and that's called chiropractic biophysics. And when we talk about corrective care, what we are is we're differentiating between short-term pain relief, which you see many, quote, crack videos show, where someone gets their spine manipulated, you hear a cracking noise, and that's great for short-term pain relief, for improving range of motion, reducing muscle spasm. But if you want long-term pain relief, if you want to prevent spinal degeneration, if you want improved health outcomes, we need to actually change the alignment of the spine as close to normal as possible. And that's what corrective care is. Corrective care always includes pain relief at the beginning. So there's three parts to your care: pain relief, correction, and then maintenance. Now, I specialize in treating chronic health problems. Chronic L4, L5 disc bulges, disc herniations, chronic peripheral neuropathy, chronic foot problems, chronic knee problems, acute and chronic whiplash. So if you're suffering with those, you need to find a doctor that does the similar techniques that I provide, which is chiropractic biophysics. So I utilize mirror image exercise, mirror image adjustment, mirror image traction. We use non-surgical spinal decompression for disc problems and in compressive syndromes. So a compressed disc would benefit from decompression. Neuropathy many times has a compressed nerve component. So corrective exercise, targeted exercises, mirror image exercise adjustments and traction, spinal decompression are the tools of my trade to help you eliminate pain, stabilize your spine, avoid spinal surgery so you can live stronger longer. Now, before I continue with this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, avoid surgery, and stabilize your spine. Also, do me a favor, like it and share it. If you know someone that has suffering from back problems, neuropathy, knee problems, share these videos. We always throw out tips every week or so. Okay, this is a normal lumbar spine. This is the belly in the front. This is the top of your leg bones called your femur head. This is the buttocks in the back. This is your tailbone. This is your coccyx. So this person is facing like this, okay? Now, I may show you an abnormal lumbar spine where they're facing the other way, so I don't want to get you guys confused out there. This is your disc, this is the vertebrae. We should see approximately a 35 to 40 degree lumbar spine. That angle is ideal for your body to absorb shock. Now, this is abnormal. Now, this person is facing this way, so I tricked you a little bit. I want to see if you guys are paying attention out there. So this person is facing this way, the belly is here, the buttocks is here, this is the sacrum, L lumbar 5, 4, 3. This is a nice disc here, and we see that L5 disc is getting thin. This person does not absorb shock as well. And eventually, when you lose that curve, your body just breaks down faster. Alignment matters, just like alignment of a car tire. So if you live on planet Earth, where there's a gravitational force, alignment matters, and we're trying to get you as close to normal as possible. And so we are using a research-based technique called chiropractic biophysics. It's a three-prong approach. We use an acronym EAT, exercise, adjustments, and traction, or mirror image, exercise, adjustments, and traction. You will see the last videos I made, we showed an adjustment and we showed mirror image exercise to help improve the lumbar curve. Today's video, we're showing two types of traction. Think of traction as pressure over time. Think of an adjustment as very brief, has tremendous benefits, changes lives, but it's brief. If you want long-term health benefits, we need to change alignment. Now, this person has an abnormal curve. The front is here, the buttocks is here. You can see there's no curve here. Now, this individual has a curve. Well, they're the same individual after surgery. All this white is rods and screws in their spine. And that would be a horrific surgery. So, yes, you can improve the lumbar curve with a horrific surgery, but at what cost? So, in 95% of the cases, we can improve a lumbar curve with non-surgical methods. Chiropractic biophysics using mirror image exercise, mirror image adjustment, mirror image traction. Traction should be performed approximately 7 days a week. Usually 2 to 3 days a week in the doctor's office, and then home version 4 to 6 times. Some people want to speed the results and they do traction at home twice a day. That also is helpful. We always warm up prior to traction, just like you would if you want to mold plastic. You are going to warm the plastic up. We are changing the ligaments. We are not working on the muscles with traction, all right? So we are changing the ligaments. The disc is part of the ligament, trying to induce a curve. Now, this is an abnormal lumbar lordosis. Okay, the red is abnormal and the green is normal. So this person is the opposite. That's a terrible spine. That person is not going to be comfortable lifting, standing, sitting. Now this is a bad spine, but not as bad. See how it's a straightened. This is a reduced curve, both of these. This is ideal. Now, we would put the Dinero roll, which I'm going to show you in a minute, in different places. Some people need it low, some people middle, some people high. Everybody's different. This is not a one size fits all. This is not a device you can get on Amazon, everybody use it. This is a very simple, it's very specific to the individual patient. And it's based on the individual patient's x-rays. And you need to get x-rayed by someone that understands the biomechanics and a corrective method to not only assess you properly, make sure you're a safe candidate, but also for correction. This is what it looks like where someone is placed in the mid-lumbar spine. The belt line is here, and they're using a block to also move the rib cage. So again, this depends on what your x-rays look like. So this is an abnormal x-ray. The green is normal and the red is abnormal, but this is the same individual while they lie on this block. So we're actually x-raying an individual patient. It's called a correction potential. What is the potential for you as an individual? Not me, but you when you lie on the lumbar Dinero roll. That way it gives us very specific guidelines on where we can place it. We might need to switch it, move it up an inch or move it down an inch, and everybody has a different potential for correction. So again, this would be the lower lumbar vertebrae, and I'll demonstrate that. This has a block here. This is the middle of the lumbar, and this would be the upper lumbar. So again, everybody's different, and many times we'll put a thoracic block under the rib cage to shift the rib cage upwards and also to reduce pressure on the back. We will demonstrate lumbar extension traction or three-point bending in our office. Again, so these are the different types of correction or types of traction positions. Some people lie down, some people kneel, some people sit, some people stand. It depends on what's comfortable for the patient, and also it depends on what your x-rays look like. What does traction feel like? Well, it does not hurt. It'll feel like a deep stretch, particularly on the lumbar Dinero, like whoa. But as you breathe into it and relax, it'll get easier with time. So we usually start again a couple minutes and work up to 20. Ideally, traction should be done at least 7 days a week. And typically, it is part of a corrective program: adjustments, exercise, and traction. And typically, we do a reevaluation every 30 days with a post x-ray at 90 days. Okay, most of the research are done with a 36 visit protocol, and typically we will see a percent of correction at that time. So again, how often traction? 7 days a week, usually 2 or 3 days a week in the doctor's office, the rest at home. We accompany it with exercise and adjustments. Typically it's a 3-month protocol. Typically we take x-rays at the end, usually in 90 days, and it does not hurt. I want to be very clear, it does not hurt. You should never have pain or blurry vision or dizziness or pain going down your legs. All those are contraindications, and that should be changed to a different type of traction. And again, it does not hurt, but it will feel a stretch, okay? And it gets easier with time. At first, the traction is hard, just kind of like putting braces on teeth. At first, except the braces on teeth are usually way more painful. So if you put your kids had braces, this is not going to be nearly as uncomfortable, but it is a stretch, okay? And again, if you're in acute agony, we don't start corrective care until we've reduced the pain, muscle spasm, and things like that. So this is not at the beginning phase of your care. This is seated lumbar extension traction. This is to improve the lumbar lordosis and correct what they call flat back syndrome. This is a type of what we call a 3-pole system, okay, 3 contact points. What we're doing, the main pole is right here, and depending on the x-rays, we'll pull either at the lower lumbar around your belt line like L5, or we pull in the middle. Some people will be sitting up straight, some people will need to go forward a little bit. It depends on your x-ray. Most people talk about it, they're comfortable when they do it, it's not painful. Most people have the feeling like it takes pressure off the joints. Most people tell me that they sit up, they feel like they're sitting up straighter. This is a lumbar extension 3-point bending. And we can do this seated, we can do it standing. Again, it depends on what's most comfortable for the individual, and it depends on the x-ray findings. We complement this with the home version of Dinero roll, and we'll show that in 1 minute. And typically, we start off like maybe around 3 or 4 minutes, very light. We see how the patient tolerates this. So everything we do is we do a pressure test first, right? We've already tested them in the exam, we look at their x-rays, but then we actually put them on the actual corrective traction. This is a corrective traction to improve the curve. And again, we go anywhere from 3 minutes to 20 minutes for this. And the same thing when we recommend people to do corrective traction at home. And we typically would do this 3 times a week in the office. Okay, this is a lumbar Dinero roll, the home version, all right? And many times we'll start off using it in the office to get you accompanied with it. And it depends on your x-rays. Some people need to place this in the lower lumbar, some people in the middle, some people in the upper. So typically we always recommend you warm up your spine. Very simple, just like if you were molding plastic, you would heat it up and then you would put it in a mold. Think of traction as spinal molding. It's pressure over time to change alignment. Long-term health, long-term pain relief, long-term restored function basically requires pressure over time. So the adjustments unlock the vertebrae, take pressure off the nerves, reduce muscle spasm, reduce pain, calm the nervous system, have many benefits. However, the adjustments need more time to make a long-term correction. That's where we have traction. So think of traction as a long adjustment. All right, so this is how we would do it at home. The person warms up, the knees are bent, and what they would do is they'd lie on their back, and then they're gonna lift their hips up, and they're gonna place it under their spine, okay? And then they're gonna lie back. And then when they get up, they're gonna lift their hips up and just slide it out. Now, it may be placed like this, or it could be placed like this. All right, again, you can lie back on it, but for most people it's more comfortable if you lift your hips up and then you place your butt down. You would start off with your knees bent, then as you progress, your legs would be straight. And then when you get up, lift up and come out. Nothing should be painful. It should feel good to you. Very simple. Whoa. And very simply, it should be within your tolerance. All right. We usually start a couple minutes, work up to 20. All right. So we just showed you the different types of lumbar extension traction. And right now, at the end of this video, I'm going to show you how to find a chiropractic biophysics doctor. And it's very simple. Just go to www.idealspine.com. That's www.idealspine.com. Idealspine.com. Now, the best type of doctor for straightening of the lumbar spine is a corrective care chiropractor trained and certified in chiropractic biophysics. So it's very simple. If you want long-term health changes, we need to change alignment, and you need to find someone that does chiropractic biophysics. It has over 360 research-based publications. Now, how do you know if this is right for you? Well, number one, if your X-ray report or MRI report says you have straightening lumbar spine, that's a good idea. If you tried other treatments like physical therapy, even what we call pain relief chiropractic, drugs or injections, and you still have back pain, then I would get an X-ray by a CBP doctor and see, do you have a flat back or a decreased lumbar lordosis? The best way to know if it's right for you is to get a checkup by a CBP doctor, that's chiropractic biophysics doctor in your area. Again, go to www.idealspine.com. So if you're dealing with a straight lumbar spine or flat back syndrome, don't lose hope. You're not broken. You're not stuck. Your spine has the potential to change, to heal, and improve with the correct approach. Lumbar extension traction, along with other methods I shared in this series, can make a world of difference, and you don't have to do it alone. If you're already ready to take the next step, I encourage you to find a certified chiropractic physics doctor near you. Just check the directory at idealspine.com. And if you found this video helpful, do me a favor, give it a like. Share it with someone you know that has spinal pain, that wants to avoid surgery, wants to have a physical life. Also, drop us a comment below. I want to hear your story. Make sure to subscribe so you don't miss out on more helpful content. And if you haven't seen it yet, go watch my video on the 3 easy-to-do exercises for straightening the lumbar spine. It's the perfect video to watch next.